Welcome to the Kudlow Report. We're here live at 7 p.m. Eastern and 4 p.m. Pacific. We begin tonight with breaking news from the White House. The National Association of Insurance Commissioners has just told President Obama that his fix for canceled health policies could result in higher premiums and gaps in coverage. This all comes as a new CBS poll puts President Obama's approval at a stunning all-time low, only 37%. And opposition to Obamacare at an all-time high, 61%. Good evening, everyone. I'm Larry Kudlow. This is the Kudlow Report. Fresh out of a meeting with the president, state insurance commissioners still say his proposed Obamacare changes are creating uncertainty. We need to explore what that means. Joining us now, Republican Congressman Brad Wenstrup, Bob Leshevsky, president of Health Policy and Strategy Associates, and Ovik Roy, senior fellow at the Manhattan Institute, author of How Medicaid Fails the Poor. Okay, gentlemen, the insurance commissioners sound pessimistic about cancellation renewals. The back end and payments mechanism on the Obamacare website has yet to be built, according to one of the HHS people. And we're coming up to an enormous 2-week crunch period to make the January 1st deadline. Bob Leshevsky, how is this going to play out? None of this reads well.
No, it's just one disaster after another. You know, the insurance commissioners told the president today this isn't going to work. You know, Larry, Kathleen Sebelius, the Secretary of Health and Human Services, is a former president of the National Association of Insurance Commissioners, the former insurance commissioner of Kansas. If she'd have been commissioner of Kansas and the president of the NAIC, I'm sure she'd have been telling him this. You're not going to invite me on this program anymore because I keep asking the same question. Who is advising this president when it comes to how the insurance markets work? I just don't get these guys.
Well, okay, join the crowd. I guess that's it. I've never seen it. There's no quarterback. Brad Wenstrup, let me go to you, Congressman. Yesterday we had these revelations from Mr. Chow from the HHS. He says 30 to 40% of the website is not built, specifically the back end and specifically the payments mechanism. Now, my question is just a simple one. Even if you got renewals, all right, and Bob Leshevsky says you got to get it in by the first half of December, how are they going to work this through if you can't pay for it and connect the website to the insurance company? That's the part I don't get.
Well, that's the big question, right? And we just certainly can't turn back time and wish it was another day before this all started taking place. People have prepared for this for 3 years, at least on the provider end, and people in the insurance business have planned for this for 3 years, and now it's falling apart because it's not ready. This is an extremely difficult time. I think the #1 diagnosis for people these days is going to be anxiety and stress. And you know what? As a congressman trying to help out my constituents, I can't help them. This is really a big problem. And each day, the dominoes keep falling, so we don't know how to address it. And also, we also see where often the rules get changed just by the president saying they're changed.
You know, Ovik Roy, come back to you. Something the commissioners, the insurance commissioners said in their, I guess, a printed, published release, that premiums are going to go up. Now, it sounded to me, I don't know, you have to give me the details. In other words, renewal premiums will go up, or just premiums in general are going up. Both contradict the president, who keeps maintaining that premiums are going down. Which is it, Ovik?
Well, premiums are going up both for people who are going to renew their old policies. The early reports we're hearing is about 20 to 25% increases on the same plan that was supposed to be canceled but is going to be able to be continued. And plus on the exchanges, premiums are going to have to go up. Their rates aren't going to go up this year because those rates are set. But if healthy people stay out of those exchanges, then if you have older and sicker people, then premiums will go up there. And let's not forget the rest of America, the people who get employer-sponsored coverage, they're going to see increases of 10, 15, 20% depending on where they live. So this idea that the president has that somehow only 5% of Americans are being affected by these problems, it's not true.
All right. By the way, we're going to get to the employer-based issue later because there are some big numbers out there. But Bob Leshevsky, let me go to you. I'm still not sure I understand. If some state, let's say half the states allow the renewals to go through. Maybe more than a little bit, half the states. I don't know what your estimate is. They go onto the website. The stuff we learned yesterday, this is what I don't get. I think you mentioned this, the so-called 834, 824 exchange or something. There's no connection to the insurance companies. If you can't pay for this stuff and you can't connect with the insurance companies, how do you get this done in the first 2 weeks of December leading to January 1st? That's the part I don't get.
This is a whole different problem. The 834 transactions, which we've talked about before, is just the federal government sending the enrollment to the insurance company, which has been going on as people have been signed up, and that's been a mess. This is a whole nother dimension. What this is about is that once everybody gets signed up for January 1, the federal government hasn't built the part of the system yet that will transmit the federal government's portion of the premiums to the insurance companies. And more than that, they haven't built the part that reconciles the specific people the insurance company thinks they've got covered with the federal government. This is tantamount to starting up a bank over down on the street corner, taking people's money, giving them a checkbook to write checks, but the bank, having done all that, not figured out how to send out monthly statements. And when the CMS spokesman was challenged on this the other day, she said, it's no big deal. We don't have to figure this out until January. I mean, this sounds like a fly-by-night operation here. It's just incredible. It's
Brad
stunning.
Wenstrup, were you in this hearing with Mr. Chow when he unveiled this 30 to 40% number that hasn't been built? See, what I'm trying to figure out is, can anybody complete the transaction, okay? You can do the application, you can do everything you have to do, but you can't get through the payment. If you can't pay, then I'm assuming the insurance company doesn't make it official. You don't get your membership card, you can't go to your doctor or whatever. How's anybody going to get through this? This is the point I'm trying to figure out.
Well, the American people are handcuffed right now. They really have nowhere to turn, right? They're supposed to do things. They can't get it done. The government hasn't provided it. It is really a sad time, I think, for America, that this is something that our government has rolled out, especially with so many warning signs that it wasn't ready. And like I said before, this makes it extremely tough to try and take care of the American people. I don't have the answer for you. We're assessing things every single day. I'm part of the Doctors Caucus, and within our caucus there, we're trying to look at things and say, how can we fix this? But the problems are mounting each and every day.
Well, that's the thing. How can you not, in good faith, okay, politics for a minute, Republicans versus Democrats, just last question on this. How can you not extend all these deadlines for the good of the people who want to renew their insurance or the other people who want to sign up? Do you see what I'm saying? In other words, how can you help ordinary individual men and women, whoever they are? This is not politics. When you see these obstacles, the website is not built, the payment mechanism is not going to work, and the timetable is very tight. Somebody's got to step in, Congressman, and say, darn it, let's have I guess, a bipartisan bill just to extend the bloody thing.
Well, that's exactly right, and that is something, of course, that we tried, as you know. But we are in a situation right now where we need a huge timeout. And, you know, as I look forward, time goes by fast around here. It goes by very fast. The State of the Union address is going to be awfully interesting in January.
The problem, Larry, is that politics does intervene, because the administration launched this website on October 1st knowing that it wasn't going to work. We just learned from the House Oversight Committee, they disclosed some documents today, an email chain that showed that they knew that they were going to have all these problems with hang-ups and people not being able to log into the website days before they launched it, and they still launched it because they were so afraid of the criticism they'd get if they had to eat crow and delay the website, which is crazy.
They're eating a lot of crow right now. Bob Lachevsky, give you the last word on this, then we're going to hear on another topic. You're still saying the first half of December, unless there's any extensions and changes, the first half of December is absolutely crucial. Can you just quickly expand on that thought?
Right. Well, everybody's geared up to be signed up for January 1st. All these people that have gotten their cancellations have got to sign up for a new policy January 1. All of these people with pre-existing conditions who've been trying to get signed up finally get their subsidies by January 1 are anxious about all of this, have to be signed up by December 15th in order for their coverage to take effective January 1. If we don't have the ability to enroll people by really December 1 to December 15th is a 2-week period here. where I think we could have hundreds of thousands, if not millions of people come flooding through this thing. You know, we can debate about whether Obamacare is going to be popular or not. For Pete's sakes, there are 5 million cancellations out there. And then all of the people that are desperate to get signed up. We have the potential for an incredible number of people to come flooding through. But if this thing isn't fixed, it gets back to what Avik just said. The administration pushed the button on October 1, and they set in place a domino effect, and the dominoes are still falling. And the congressmen can't stop it. The insurance companies can't stop it.